delicious, but sometimes they get ill. Dr. Joelene Huber is here. She's our pediatrician and health columnist also at today's Parent Magazine. And we're not just talking about the kids, we're talking about all of us. When should we go to the emergency room or the walk-in clinic or to see our general practitioner or a doctor? So there are different situations and scenarios, and you sort of have to gauge and use your gut instinct as well. Right. Let's start with the emergency room. The general rule of thumb, when would you go there?
Right, so the general rule is if it's life-threatening, of course, or if it's could cause permanent disability or permanent harm. So things like that could be a broken bone, or you think it's a broken bone, a wound that needs to be sutured or sewn up, and then of course any kind of serious symptoms like stopping breathing, choking, your child's choking, chest pain, a sudden and severe pain that's not going away. All of those kind of, even a mental health crisis, one of the best places to go is the emergency room to get help. So all of those kind of things where it could be something that's life-threatening or really serious, you're calling 911 or you're going directly to the emergency room.
Okay, now we always have sort of a gauge here, and I think this is provincial. We have telehealth, right?
Yeah.
Often they can sort of give us some sort of a gauge on what you should do, if you should be taking it seriously. I think most of us would know if you're choking, like go straight to emergency, figure out if you can't handle it at home, figure it out. But if you are looking for a little bit of more guidance.
Right, and I think most of us know when it's an emergency, and that's pretty clear. It's those more gray areas, and actually one of the most common texts I get from my family, my neighbors, and my friends is, should I go to the walk-in if it's after hours? Should I go to the emergency? Should I wait till tomorrow? Can I wait? And that's a really big question. So you mentioned telehealth, that's here in Ontario, but most regions in Canada have a health line that you can call, and I can post it on the website for your region. But you can talk to a nurse and say, my child has a fever, what do I do? And they'll walk you through step by step and help you to know exactly where to go. So if you're not sure, talking to somebody for sure.
Let's talk about fevers. So if your child has a fever, is that something you can monitor, or at what point do you take the next step?
Yeah, and that's a really big question. So if your child is less than 6 months, they should always be seen by a doctor if they have a fever. Other things, if they're really cranky, unusually irritable, lethargic, if they're not taking fluids or drinking, then those are concerns, and they have a fever when you should go seek help. Another thing, if it's an older child and it's greater than 72 hours, you want to go see a doctor, because that's sort of a bit of an ongoing fever and something to get checked out.
Okay, if you can't get into your after-hours clinic, go to emergency. Or if you can't get into your regular physician, you go to emergency.
Or you can go to a walk-in clinic.
Or a walk-in clinic, if they're open. Okay, let's talk a little bit about walk-in clinics or urgent care clinics. At what point, what's the general rule of thumb for when you use them? Yeah,
so the walk-in clinic is really for after hours, or if you call your doctor and they say, well, I can see you by Friday, but you think, oh, this is a really sore throat, or I have an earache and I really need to be seen, or I want to be seen by somebody. A great thing about the walk-in clinic is you don't have to have an appointment, you don't have to wait as long as in an emergency room, and they can really deal with those, put out fires quickly. The downside is they don't really know you, they don't know your past medical history as well, they don't know your medications or allergies. So if you can come prepared, make sure that you tell them your past medical history, your medications, your allergies, and that will really help them. The walk-in clinic should not be the place that becomes your primary health care. It's really important to have somebody that gets to know you, because some issues develop and evolve over time. So it's a great place to go if you need something in the evening and your doctor is not available. It's a good place to go for sort of those simple, more minor issues.
Now, if you do go to the walk-in clinic, you basically have to tell them, you have to know what you're allergic to, all the medication you're on. You have to catch them up on all of that, because they don't have your history. They don't have your file, as you said.
Yeah, and so it's helpful to, and if you always keep a list of your medications, keep it in your wallet or in your purse, it's helpful just so that they have a context of what's going on.
Now, how about regular doctor, physician? We know they're well visits, they're preventive visits. When should you be seeing your doctor?
Yeah, so when you're pregnant, you can get already look for a family doctor or a pediatrician for your baby when they're born, and you really want to have those regular checkups when you have a young child, and even when you're our age and when you're older, you definitely should be going to somebody regularly. Just like you go to the dentist, you have your checkups, you should go to the doctor really for exactly what you said, preventive. So screening for cancers, screening for your child's development, getting their immunizations, and that's your sort of once a year kind of checkup as you're getting older. But as you're young, there's a strict guideline in terms of when you should see. Yeah, so at 1 week, at 2 months, 4 months, 6 months, and so on. And your doctor will help you to know when to come.
Okay, all right. So well visits are very important. When you get to our age, it's once a year? So once a year is pretty much sufficient if you're feeling healthy.
It depends on your age and your health.
Okay.
But you can talk to your primary care, say, can I come, should I come next year? Is it 2 years? And they'll let you know. And also depending on what screenings you're having done at that age. So talk to your primary health care provider and they'll give you the schedule of when you should be seen, but don't sort of go for years without being seen.
Yeah, for sure. Did you hear that? Don't go for years without being seen. Let's put the information for the healthcare lines for all of the provinces and territories that we can find on our website. That is at cityline.ca. You'll find it there. Let's go to break. Thank you, Doctor.